Okay, so today we will be talking about oculocutaneous albinism type 2 as part of my Human Genetics 220 Week 3 presentation on a human disease pedigree. So I have created this pedigree to show how OCA type 2 can be passed on and inherited within a family. So since OCA type 2 is a recessive autosomal disorder, both parents must carry the recessive allele in order for the disease to be passed on to an offspring. However, even if only one parent has the allele, it can be passed on to an offspring, which is then a carrier for the disorder. Since this disease is autosomal, it is not X-linked, so sex will have no effect on how the disease is inherited. So as you can see in the first generation, the male, who is individual 1-1, is a carrier of the disease, while his wife, individual 1-2, is affected by the disease. Her phenotype shows that she has OCA type 2, meaning that her genotype is a. Since the male is a carrier, he has to have the genotype A, meaning he's heterozygous. Reproduction between this couple would have a 50% heterozygous genotype of A, and then a 50% chance of a homozygous recessive of a. That would be the affected individuals. This pair has 3 offspring: a female carrier, a male affected, and a female affected. Both the females reproduce with separate homozygous A males. Female 2-2, the carrier, has 4 children, including 2 non-carrier females, 1 non-carrier male, and 1 carrier male. None of these children marry. Individual 2-2 sister, which is individual 2-4, is the affected female and reproduces with a homozygous unaffected male, meaning he is not a carrier of the OCA type 2 gene. The pair produce 2 female offspring, both of which are carriers. Individual 3-6 marries a carrier male. 2 carriers reproducing will have a 25% chance of producing a homozygous unaffected with the genotype A, 50% chance of a heterozygous carrier with the genotype A, and then 25% chance of a homozygous recessive with the genotype a. That individual would be having OCA type 2. This couple ends up having 3 children, 1 female with albinism, meaning they have an a genotype, 1 carrier male, and then 1 unaffected male. The female with albinism reproduces with a male with albinism. Since they both have the genotype a, all of their children will have the same genotype and then will have the phenotype of albinism as a result. This is shown in generation 5 of the pedigree. So what gene causes OCA type 2? Oculocutaneous albinism type 2 is caused by a variation in the OCA2 gene. The OCA2 gene's purpose is to assist in the making of the P protein, which is necessary for the normal pigmentation to happen. The variants of this gene, which are often a result of a deletion, will cause a reduced amount of melanin produced by their melanocytes. The OCA2 gene is located on chromosome 15 at the address 15q11. This disease is autosomal recessive and is passed on through the recessive allele. So how does OCA type 2 manifest? OCA type 2 causes affected individuals to have cream-colored skin and lighter eyes and hair than most of their close relatives. They will also be very sensitive to sun exposure and are at a much greater risk of skin cancers like melanoma. Type 2 differs from OCA type 1, which causes hair and skin to be almost pure white. Both types will suffer from vision problems, however. OCA type 2 is much more common in those with African ancestry. It is also the most common type of oculocutaneous albinism. As you can see in the images shown below, type 1 shows the phenotype that we typically think of people with albinism. These individuals have very light skin, purple or red eyes, and near white hair. Type 2 is similar, with highly reduced melanin, but those affected have more cream-colored or blonde hair rather than pure white. They'll have blue or very light brown eyes and a lighter skin tone, but not yet paper white skin tone. So how is OCA type 2 diagnosed? Well, while OCA type 2 can usually be determined based off its visible effects that are caused by the phenotype, such as pale skin, light eyes, and hair, molecular genetic testing can be done to confirm that this person has OCA type 2. Molecular genetic testing looks for differences in a certain gene. In this case, researchers would be looking for a mutation in the OCA2 gene, which would cause oculocutaneous albinism type 2. In this slide, we will be talking about the difference between a healthy non-mutated OCA2 gene and a mutated OCA2 gene, which will cause OCA type 2. So the image on the left is a normal, non-mutated version of the OCA2 gene. This gene is able to properly relay the instructions to build the P protein, which allows melanin to be produced properly. In the mutated variant of the OCA2 gene, the P protein produced is defective and unable to properly synthesize melanin. This will cause the individual to have OCA type 2. So what is the clinical outcome of having OCA type 2? While albinism itself will not cause a shortened lifespan, its symptoms can. For example, since albinism makes those with the disorder very sensitive to UV rays from the sun, they are much more likely to get skin cancer. Like all cancers, skin cancer can be fatal if not discovered soon enough or if it does not respond well to treatment. In terms of quality of life, OCA type 2 will cause vision impairments and puts the individual at risk of sunburns. However, they will not have overly negative effect, and individuals should be able to lead a happy, healthy life as long as they take the proper precautions. So is there a treatment? There is no definitive cure for OCA type 1. However, there are things that can be done to reduce its effects. Here are 3 ways. The first is to reduce sun exposure. One of the most damaging effects of any type of albinism is the extreme sensitivity to sunlight. To avoid skin cancer and severe burns, those with albinism should limit sun exposure, use high SPF, and cover skin when outside. The second way to reduce symptoms is to get regular skin exams. People with albinism should have an annual skin exam with their dermatologist to check for signs of skin cancer. Skin cancer can show in the form of moles, cancers, and precancerous lesions. Any suspicious spots should be removed and biopsied. The third is to use visual aids to help with vision loss caused by OCA type 2. People with albinism will suffer from central vision loss and will need low vision glasses with microscopic or telescopic lenses. We have come to the conclusion of my presentation on the autosomal recessive disorder oculocutaneous albinism type 2. Here are the resources used to gather information on the disorder. You can check them out for more details. Thank you for following along with me.